Good afternoon, everyone. My name is Shruti and I am a professional science master's candidate in biomedical and health informatics. And I'll be giving a presentation on my internship project entitled Caregiver Recruitment and Retention at Nurse Care of North Carolina. So first of all, I'll start with introducing my topic. The caregivers that are the registered nurses, licensed practical nurses, certified nursing assistants, and personal care assistant form the centerpiece of the long-term care industry. And they provide hands-on care to a large number of elderly and younger people with chronic illness and disabilities. They provide this kind of care on a daily basis, and this care is quite intimate, personal, both physically and emotionally challenging. So they develop a cordial relationship with the clients, and they are therefore referred as the eyes and ears of the long-term care industry. And this class of caregivers are amongst the lowest wage earners in United States. And the long-term care industry is currently facing a serious problem or shortage of such caregivers. And this shortage is multidimensional, and it can be attributed to negative growth in wages and benefits that is due to the dissatisfactory work conditions and large percentage of nurses reaching retirement. And in recent times, the home care and facility companies facing figures and statistics in the next two slides. Here the first graph shows the continuous rise in direct care workforce over the years, and the continuous fall in their real wages from 2004 to 2014. And therefore, an increasingly unstable caregiving workforce with their already low compensation eroding more each year will further threaten the continuity and quality of care that they provide. And the second graph here shows a continuous rise in the caregiver turnover over the years from 2010 to 2015. While discussing this graph, we should keep in mind that the turnover is also associated with some costs. Therefore, the direct care labor advocates argue that raising compensation for these workers would result in net savings due to lower turnover rates and improved health outcomes. Now, the graph on this slide, the first graph, shows a correlation between CNA turnover and national unemployment from the year 2007 to 2012. The parallel here is that the healthier the economy, the more job options are available for workers, and the harder it becomes to attract and retain paid caregivers. And the second graph, the bar plot here indicates the huge gap between the supply and demand of direct care workforce, and it shows that the number of women entering the workforce between the ages of 25 to 54 from 2012 to 2014 were 227,000, whereas the demand is close to 1.3 million. And these are the projections for year 2012 to 2022. So just like its peers, nurse care also faces similar issues. And my project, internship project, was concerned with addressing these issues with respect to the nurse care of North Carolina. So I would like to introduce nurse care of North Carolina in just 2 points. First of all, a nurse care is a premium healthcare services company that provides in-home care and medical staffing needs to the Central and East North Carolina communities. And it provides hands-on companion and nursing care to patients seeking care individually at home or at some healthcare facility. Now, I'll just highlight the challenges faced by nurse care. The first challenge was recruitment of high quality caregivers, and the second one was retention of these caregivers over a meaningful length of time. So the aim of this project was to address the following question: how can nurse care improve its recruitment and retention strategies so that it can provide better, more reliable, and more consistent quality care to its clients over time? So the approaches that I adopted to address this question were: first, analyzing the company's existing recruitment strategy, and followed by analyzing the successful and unsuccessful hires in the last few years, understanding the level of job satisfaction amongst the current caregivers through surveys, and understanding the work experience of former caregivers with nurse care through surveys, and understanding the current hiring environment via in-person interviews and surveys. Now I'll discuss the steps in the data analysis. The first step that I took was data collection. So data was collected via interviews, surveys, and companies' employee management system, that was ERSP. And for the interviews, in-person interviews were conducted with the company's HR team and the care coordinators to understand companies' existing recruitment strategies and concerns and the hiring environment. And separate surveys were created for the former caregivers, the current caregivers, and the prospective caregivers. The surveys for the former and current caregivers was created, distributed, and collected via Google Forms. And the survey for the prospective caregivers was taken in person by me after they went through their regular interviews at the company. And the data from the employee management system of the company was obtained by running some reports in CSV format that was later on used for analysis. And the second step was data cleaning and transformation. Data obtained through surveys and interviews was used as such, but the data obtained from ERSP was cleaned because the caregiver data before 2012 was not required, as the company was interested in analyzing the data for the caregivers from year 2012 to 2017. And due to some error while data entry, some of the caregivers' age in the spreadsheet was less than 18 years, so those caregivers were also eliminated from the analysis. And as far as the outliers are concerned, some of the caregivers' employment duration with the company was less than a week, so those caregivers were also not considered while analyzing the data. And there were various attributes like length of employment, caregiver retention percentage, and staying probability that were also calculated for better data analysis. The third step was data analysis and interpretation, which I'll be discussing in detail in the subsequent slides. And for this step, I used R programming, Excel, and Google Analytics feature that was in Google Forms. Based on the results that I obtained from the data analysis, I provided some recommendations to nurse care on how to improve the caregiver retention. Now, coming over to data analysis and interpretation. This graph shows the trend in employment duration of the caregivers from 2012 to 2017. And due to obvious reasons, this graph will always have a negative slope, because the caregivers that were hired earlier would have larger time for larger duration of employment as compared to the ones that were hired later on. So as we can see, the drop in the employment duration for the caregivers from 2012 to 2013 was quite high, and same goes for the length of employment for the caregivers from 2015 to 16, and from 16 to 17, it was higher than it should actually have been. So moving on to the next slide, this pie chart shows the caregiver retention percentage for nurse care on an yearly basis. And for this, I actually calculated the number of active and inactive caregivers from 2012 to 2017, and then used and then calculated the percentage of active caregivers on a yearly basis, which I used to represent as caregiver retention percentage in this pie chart. So we can clearly conclude from this pie chart that year 2017 was best for nurse care as far as caregiver retention is concerned. Lately, nurse care also realized that they had a large number of no-call, no-show candidates. So they started recording the number of no-call, no-show candidates from March of 2017. So I also analyzed the trend in no-call, no-show candidates on a monthly basis for the year 2017. This graph shows the trend in hired and no-call, no-show candidates for 2017 on a monthly basis. And we can see from this graph that the month of March, May, July, and August had the most number of no-call, no-show candidates. And similarly, I also visualized these trends for each of the offices in Durham, Raleigh, and Greensboro. So for the Durham office, the months of March, July, and August had the highest number of no-call, no-show candidates. And this trend was analyzed because nurse care wanted to identify the months in which they saw largest number of no-call, no-show candidates, so that they can address this issue based on a monthly basis, like they could have more number of interviews and things like that. And for the Raleigh office, the months of May and August had the highest number of no-call, no-show candidates. And for the Greensboro office, March, May, and August were the months with highest number of no-call, no-show candidates. So after I visualized these trends, I went on to look for reasons behind these trends. So the two tools that I used for this were regression analysis that I did using R programming, and the surveys that I did via Google Forms. So I'll start with the regression analysis. So I did regression analysis for the former caregivers to look at the factors that affected the duration of employment of the caregivers with nurse care. So I did this analysis for each of the offices in Durham, Raleigh, and Greensboro. So this is a screenshot of the R Studio editor, and it shows that I ran regressions to evaluate the effect of 4 factors that were caregiver class, their gender, their age, and the year in which they were hired. And I came to a conclusion that gender, age, and hiring year had no effect on the duration of employment of the caregivers, whereas the caregiver class had a significant effect on the duration of employment. And the results for the caregiver class is down here in the console, where you can see the caregivers of class, caregivers that belong to CNA class 1+4 tend to stay longer with the company as compared to other classes. This can be proved by the t-value, which is more than 2.5 in the case of CNA 1+4 caregivers, and the p-value, which is less than 0.05. And similar results were seen for Raleigh and Greensboro offices as well. Here also, the CNA 1+4 caregivers the p-value was more than 2.5 and the p-value was less than 0.05, which indicated that CNA 1 plus 4 caregivers tend to stay longer with the company. Same goes for the office in Greensboro. Now I'll discuss the second part for the second part of the identifying reasons. That was the survey analysis. As I already mentioned, I conducted the surveys for former, prospective, and current caregivers separately, out of which the former and the current caregivers survey was conducted through Google Forms, and the prospective caregiver survey was conducted via in-person interview. So I'll begin with the former caregiver survey. So as far as the participants are concerned, a total of 39 caregivers participated in the survey, in which the majority of them were CNA 1, and majority of them had more than 10 years of experience. And I would also like to share some of the key questions and the response that I got from the former caregivers. On being asked what did they like most about their job at nurse care, the top two things were the relationship with the clients and the schedule flexibility. And I even asked them a question like, did they participate in any of the nurse care benefit programs? And the top two programs in which the former caregivers participated were Stars and Strike bonus program and the classes and training opportunities. So I had some observations after I did the survey for the former caregivers, which are the caregivers that reported their overall experience with nurse care as bad mentioned their communication with the office staff as difficult or very difficult, and vast majority of the caregivers that were not satisfied while working with nurse care also mentioned pay scale as a concern, and they still work as a caregiver. And most of the former caregivers that reported their overall experience as great mentioned their ease of communication with the office as easy or very easy. So we can conclude that the job satisfaction of the former caregivers depended a lot on the ease of communication with the office staff and the pay scale that they were offered. And 73% of the caregivers that said they were given appropriate training and tools to succeed at their job. And the top two areas for improvement according to them were pay scale and communication with the office staff. Now coming over to the current caregiver survey. A total of 98 caregivers participated in the survey, and out of which the vast majority were CNA ones, 58% of them. And some of the important questions that were addressed during the survey were like, on being asked their satisfaction level as far as the pay scale is concerned, I got a mixed response with approximately 29% of the caregivers saying they were satisfied, and equal percentage of caregivers said they were dissatisfied. And on being asked what did they like most about their job at nurse care, the top two reasons came out to be relationship with the clients and schedule flexibility. They were also asked whether they participated in the bonus programs at nurse care. So majority of them participated in Stars and Strike bonus program and the classes and training opportunities. And as far as their overall experience is concerned, most of them said their experience was great or good. So the observations that I obtained from the survey that I did with the current caregivers was that CNA ones were the most dissatisfied class of caregivers as far as pay scale satisfaction is concerned. Most of the caregivers that had negative or were not able to answer this question as like they had a good or bad experience mentioned that they were not satisfied with the pay scale, as 74.5% of the caregivers was satisfied by the number of hours that they worked at nurse care, but 24.5% of the caregivers wanted to work more hours. And majority of the caregivers that said that they have been given appropriate tools and training to succeed at their job, and 63.6% of the caregivers never attended the employee appreciation events. And on being asked how long do they see themselves working with nurse care, 47.9% of them answered they see themselves working more than 5 years with nurse care, and 39.4% answered 1 to 3 years. The current caregivers survey was a quite detailed one, so I even asked them to rank the form in which they would like to get rewards. So the number one rank was hourly pay increase, the second one was bonus, and the third one was individual recognition at the company. They were also asked to rank the areas for improvement. So the first, the topmost ranked area was the pay. The second one was bonus opportunities. Third one was employee recognition. Fourth was easy communication with the office staff. And the fifth one was better flexibility in schedule. Now coming over to the prospective caregivers. This part of the survey was done in person after their regular interviews, and 23 participants, 23 applicants participated in this survey. So when I asked the top 3 things that they are looking for in a job, the first one according to them was good pay, the second one was schedule flexibility, and the third one was recognition. And the second question that I asked was, how would they like to be rewarded? So their first answer was in the form of bonuses. The second one was both bonuses and individual recognition. And the third one was individual recognition. And on being asked how they heard about this job, nearly 40% of them heard about this job from the current employees, and 35% of them, nearly 35%, heard it from Indeed. And things that interviewees appreciated about the interview process was that the process was quick, and the interviewer was professional, friendly, and clear about the job. And the interviewees also appreciated that the company is flexible on schedule. Now I'll discuss some of the technological aspects of caregiver scheduling system. And I'll highlight some of the strengths and limitations. So as far as the caregiver scheduling system is concerned, the company is currently using it at its full capacity. And the caregiver scheduling system is available to the care coordinators through the employee management portal that I already mentioned, ERSP. So after the caregivers are hired, they sit down with the care coordinators, and the care coordinators use this feature in the online portal and create a schedule for the caregivers. So the strength of this system is that there's a not available feature that can be used by the caregivers. That is, the caregivers can put blocks on their schedule for the days they would not like to pick up shifts. And the second thing was, the caregivers could view their schedule after the care coordinators created the schedule. And it also had a broadcasting feature where they could broadcast the available shifts on the online portal. And the limitations was it lacked the availability feature. It would be really convenient if, just like the not available feature, it had availability feature where the caregivers could mention the days and time of the day when they are available to pick up shifts. And the second limitation was most of the communication in the company is done via phone calls, because it is more effective as compared to the online scheduling. So this feature is not preferably used by the caregivers to that extent. Now, coming to the limitations and strengths of the data analysis. As we already know, like, it's human nature to please people like your potential employer or your current employer. So we should keep in mind that the responses that I obtained via surveys might not be 100% accurate or honest. Second one was the outliers in the data set. The outliers were the caregivers that stayed with the company for less than a week. So those caregivers were removed from the data analysis. And third one was data inconsistency. These were the data from the caregivers that show on calculation showed age less than 18 years. And the strength of data analysis that I did was that the data was obtained from a single source, that was employee management system. So there was no data integration problem. And the second one was it helped me identify the trends, which resulted in better decision making. So as a part of my result, I gave some recommendations to the company, which are as follows. The first recommendation that I gave was to evaluate caregivers' performance every 6 months and conduct focus group sessions with the caregivers with satisfactory or above satisfactory performance in order to address their concerns. And the second one was to target and schedule at least twice as much as interviews for the months of March, May, July, and August, as these were the months with highest number of no call, no show candidates. And active follow-up with the candidates for these months would also be helpful. And the company should plan on giving more of career development and promotion opportunities like the CNA 1+4 classes to the caregivers to retain them for longer period. I also recommended the company to work towards improving communication between the caregivers and the office staff and increase the participation of the caregivers in buddy system referral bonus. Now, buddy system referral bonus is a bonus program in which if a current caregiver recommends a caregiver to the company and he or she gets hired, like a part of like around $1 or so they get paid for every hour that the caregiver that gets hired works. So, and 24.5% of the current caregivers express to work more hours when the surveys were conducted. So company could see if it is possible at all. And the last one was increasing the scope of helping others by providing stable assignments to encourage relationship with clients and involving caregivers while developing care plans for the clients they have been assigned. This recommendation was given because when the caregivers were asked the top two things that they appreciated about their job at nurse care, one of the top reason was the relationship with the clients. And these are my references. Thank you. If there are any questions, I would like to answer.
I just have a comment. I thought that was very interesting because all I kept thinking, when the conclusions is pay more, so you really did a good job of pulling out some of the things. And did you actually present that to the company or?
Yeah.
And what was their reaction and response to your suggestion?
Hi. My name is Noelle. I worked with Shruti this summer, so at Nurse Care. So she was great to work with, and she obviously did great work. I think the pay piece, right, is always the number one thing, right? And it's probably for most industries and most companies, but I think particularly for ours, this type of worker. unfortunately, I think we're cautiously optimistic about health insurance kind of coming into play right now, but given the kind of market that we're in today, there are certain restraints for that. I think for me, I've been with Nurse Care for about 1.5 years. The significance of the client relationship I knew was important, right? And we try to focus on that matching piece and getting caregivers and clients that have, similar interests or just generally compatible. I was surprised at how prominent it was, right? And I think it exposes, right, our caregivers we don't see them, right? We don't see them when they go to work every day, most days. So I think that piece was probably the most surprising for me. And the different way like to be recognized and more that we can do in terms of making sure that our appreciation events and bonus programs and more, and also to feel appreciated and recognized are communicated as clearly and as
Because there was a lot to, and other than pay, there was a lot there to, make improvement.
absolutely, yeah, for sure.
There's somebody joining remotely, Katya, who wants to ask a question. I think hi.
Oh, okay, this works. Can you hear me okay, or is there like an echo or anything?
We can hear you just fine.
Okay, cool. Thanks for your presentation and thanks for finding a way to include me virtually. I really appreciate it. I had a bunch of questions actually, so I can kind of limit myself, but in light of the recommendation that the other person asked about with increasing pay, what are their concerns obviously about balancing worker retention and via increasing pay, because really that's kind of the simplest way. Job satisfaction and pay are really, it's objectively always, you don't need a study to tell you that. But you have to balance with the skyrocketing cost of long-term care. So I'm wondering, I think there is a staff person there, or what did you find in your work, Shruti, about, how do you balance that between we need people who are aging to get care with we need to have bodies to actually take care of them? Did that make sense? Like basically, you're getting older, you need to pay somebody to take care of you. You can't afford to pay them a ton of money, but you can't have nobody there.
Yeah, so for me, the thing was about the pay. Most of the clients that Nurse Care has pay from their pocket, and the health insurance doesn't cover this kind of caregiver services. So pay scale is a continued issue for companies like Nurse Care. So right now, increasing pay is it's out of the question. They are paying as much as they can. So the thing is, the health insurance doesn't cover these kind of services, and this is something that we should have work on. These are the issues that we should present somewhere where the policymakers are there, and tell them that this issue is now achieving a crisis status, and they should probably reimburse such caregiver services so that the caregivers can get higher pay.
Okay, so basically it's a more systems level.
Yeah.
I'm curious about you mentioned caregiver retention. I'm trying to prioritize, and I was very confused by the line graph that you showed. You said that like March, July, August were the largest percent, and
so yeah. So that graph was for the no-call, no-show candidates. March, July, and August were the months that saw most number of no-call, no-show candidates. That is the candidates that did not appear for in-person interviews at the company. And this is nothing to do with the caregiver retention.
No, I'm talking about, sorry, the months that you stated were the lowest points on the bar graph.
Okay. The thing here is I considered March, May, July, and August as the months with highest number of no call, no show candidates based on the gap between the hired percentage and the no call, no show percentage. You can see for the months of March, July, August, and May, the gap was the least for as compared to the hired percentage. So according to me, those were the months in which nurse care saw most number of no call, no show candidates compared to the hired candidates. Does that answer your question?
I mean, I'm still.
These were the months for no call, no show candidates as in comparison to the higher number of candidates for those months. So like the total number of candidates for the months of March, May, July, and August were less in comparison to other months. So when we calculate the percentage, these months saw the highest percentage of no call, no show candidates.
It's fine. I'm sorry. I feel like you just keep restating the same explanation. I don't understand what your line graph means, but I hear what you're saying. Just the line graph doesn't.
Yeah, I think the way you showed the gap is basically the gap between the blue line and the yellow line. It can be presented as a separate graph where you would just plot the difference between the two graphs. That would be a more direct way to show.
Represent this.
Yeah, because one has to see, from far away, it's kind of hard to tell what exactly is the gap differences.
Yeah, so it doesn't have the value.
It doesn't have the value, right?
Yeah.
So.
Oh, thank you. Okay, so it's the gap between the two lines, and
Yes.
That's something that shows the numbers there. Can you define what is CNA 1+4? You mentioned that highest retention of other groups. What does CNA 1+4 mean?
So CNA 1+4 caregivers fall between the CNA 1 and CNA 2 caregivers, and CNA 1+4 caregivers are trained in 4 additional skills with respect to the company or the agency they work with, like 4 additional skills.
Oh, okay.
Yeah. And skills are non-transferable skills that they cannot take to some other caregiving agency.
Oh, well, so then it sounds like then that's consistent with the idea that providing ongoing job training opportunities increases retention.
Yeah.
I mean, okay.
Yeah.
And then I have a few other, but you seem to have a really high number of participants. You had 39 former caregivers, 98 current, and 23 prospective. So what contribute getting that's a ridiculously high number for a master's student. How do you think you did that?
So we ran a raffle for that. So
incentives.
Yeah. So that's the point that I got so many responses.
I'm sorry, that's it? You just ran over, was it a raffle for a car?
And the surveys that were sent out were far more than the responses I got. The surveys were sent to around 200 or 300 former caregivers, and for the current ones it was about 200 caregivers. So compared to that number, the percentage of responses that I got was not that much.
Wait, did you say the current were to around 300?
The current were around 200 and the former were around 300.
I'm not sure how much research work you've done in the past, but that response rate is insanely high. It's really, you should be commended. You maybe don't realize that's a remarkably high percentage. 98 out of 200, 250, even 300 is really remarkable. And so I'm just trying to figure out, that seems like it almost is speaking to the fact that the caregivers really want to share their perspective and opinions and are grateful for the opportunity to give feedback.
Yeah.
So, well, congratulations on doing that. Do you have any ideas of what next steps for you? Is this sort of like, I'm done, yay? Or do you have interest in doing any more work in this?
So right now, I have no plans on working on this right now. So
We'll take it.
the company will take it from here. This is what my supervisor says.
And how did you find out about that opportunity? Like, did it?
I think your former, you mean just in terms of her working with our
Yes,
company?
I'm doing that.
I think maybe she's transitioned to another department, but I think your former program director knew and reached out to my boss, who's the owner of the CEO and owner of the company. But we're always in the market for interns and looking for support to help us with projects like this. That's something that we have done several times in the past and we'll do in the future if people are willing to work with us.
Yeah, great benefit.
Thank you for, so I'm the program director for
Okay.
CHIP.
Okay, great.
I think you're talking about Heidi.
Yes,
Heidi
yeah.
Perkins.
Yeah.
Thanks to Heidi that we received this opportunity. We very much appreciate you taking Shruti on and giving her a nice training. And do you know about our CHIP website?
I certainly have been to it, yes.
Yeah, there is a place where you can post
Okay.
internship.
Okay.
And if you have ongoing internship, you can just post a little message there.
Okay.
And believe us, we won't remove it. It'll be
Okay.
so
Wonderful. Okay.
because it's up to you, you can filter anytime. You can say you have something or you don't, So I encourage you to go ahead and submit something if you have ongoing needs for internships.
Wonderful.
This is a very nice experience for you.
Yeah.
I have a couple of just quick questions.
Mm-hmm.
So one thing stood out that there was a 24% of people, I think, wanted to work more hours.
Yeah.
But I guess there is as far as this particular company goes, there is a upper limit in terms of number of hours you can allocate. Is that why that gap is? Or why there are still remaining people wanting to work more?
I think the primary reason is that oftentimes there's just incompatibility of hours that I'm available to work and hours that we need you to work. So
Sure.
I think that the sum total of number of hours that we have available to be staffed is quite adequate for the number. In fact, it's we have more hours available than caregivers working. That's why we're always hiring.
Yeah.
But if there's any compatibility, if I am only available on the weekends and I
That's
really
right.
need you during the week,
Right.
that's why sometimes there's that disconnect, and that's why communication is so important. And we're always on the phone.
That's right.
So yeah.
Okay, that's understandable. Another quick question I have is in terms of the technology side of it. You said the scheduling wasn't that adequate. They relied more on the phone.
Yeah.
That's interesting. Could you point to what aspect of the scheduling tool or system that didn't quite do the work? That's why they had to kind of use the phone.
So according to me, as far as the broadcasting feature is concerned, not that much of people frequently go on the website to look for the available shifts. So calling them for the available shift was much more convenient than broadcasting it on the online portal.
So that's the thing. I think one just quick follow-up. So the online broadcast is only available through going to a computer screen? Or
I think there are some text messages sent to the caregivers as well.
You can access, so a broadcast message would be sent via text. So you can get that to your phone. The technology system that we currently use today, there's not really an app. It's a mobile optimized or mobile enabled, whatever.
Website.
Yeah,
still a website,
exactly.
but you can access it through the not very user friendly to go and quickly. So when you get the text, you still have to open it up over here.
Correct.
Right? So it's not very user friendly.
The other thing with the technology piece is that what we have seen is that developing relationships, right? Our
Yeah.
best caregivers and
Yeah.
our highest kind of tenure caregivers are the ones that we know.
Yeah,
The
yeah,
ones that come into the office,
Right.
that we know
yeah.
their
Dependable,
children,
they're-
we know where they, not where they live in like a weird way, but we
Yeah,
know
yeah.
them.
You know them for a
We
while.
know them, right?
Yeah,
So
yeah,
having those
Connection.
personal connections, and you're more likely to say yes to someone that you know,
Right.
to go work with SHIP as opposed to someone you don't know, or to, alert that I can just click
Understand.
ignore and
Understand.
go about my day. So,
You know, because the informatics part is kind of important to us.
Absolutely.
That's why I'm asking this. But is that an in-house developed technology? That,
oh, no. There are probably 8 or 10 kind of off-the-shelf home care software systems, and we're currently looking at others. This positive availability feature of being able to say I'm available now, right? Or
Yeah,
here's
yeah.
my updated schedule, or
Right.
I just quit my job at this company, so now I'm available. I have
Right.
40 more hours of availability this week or this, for the next 6 months.
Mhm.
As sort of intuitive as it sounds, hasn't been fully blown out with some of the systems, but we know, actually just got a message today that one system that we're considering, is working on that for both Android and iOS. So definitely on the radar. Technology is catching up very soon, but I think once we are there, then
Might be
It'll make a
another
big
good
difference.
internship
Yeah.
opportunity.
Yeah, that's exactly right.
Test that puppy out.
One of our students vetting some of them. This would be a very attractive project. Okay, thank you very much.
Thank you.
Thank you. Congratulations. Thank you.